How is primary progressive MS, PPMS, accurately diagnosed? Imagine trying to solve a complex puzzle where each piece is a clue about what's happening inside the nervous system. Diagnosing primary progressive multiple sclerosis involves gathering multiple pieces of evidence to see the full picture. It starts with a thorough clinical evaluation by a neurologist who looks for signs of ongoing neurological decline that has been steadily worsening over at least a year. And like other forms of multiple sclerosis that have clear attacks or remissions, primary progressive MS is marked by a gradual decline from the start, without distinct relapses. Next, magnetic resonance imaging, or MRI, plays a crucial role. It helps visualize the brain and spinal cord for lesions typical of multiple sclerosis. To meet the criteria, the MRI should show at least one T to hyperintense lesion in areas like the paraventricular region, the cortex, or the brainstem. Additionally, there should be at least 2 T2 lesions in the spinal cord. These lesions are areas where nerve tissue has been affected. The MRI findings are combined with cerebrospinal fluid analysis, usually through a lumbar puncture, to look for oligoclonal bands. These bands are proteins that indicate immune activity within the central nervous system, supporting the diagnosis. Because symptoms of primary progressive MS can overlap with other neurological conditions, doctors also need to rule out other causes of progressive neurological decline. This might involve blood tests, additional imaging, or other diagnostic procedures. Emerging advanced MRI techniques are increasingly helpful. For example, the central vein sign and paramagnetic rim lesions are specific markers that can help distinguish MS from other diseases, although they are not yet standard in all clinics. The latest diagnostic guidelines, known as the McDonald criteria, have been updated over the years to improve accuracy. The most recent versions emphasize the importance of documenting disability progression over time and combining clinical, imaging, and laboratory findings. This structured approach helps neurologists make a confident diagnosis without unnecessary delays. Because diagnosing primary progressive MS can be complex, doctors often recommend follow-up visits and repeat imaging over time. This helps confirm that the progression is consistent and not caused by another condition. Early and precise diagnosis is essential because it guides treatment decisions and management strategies that can improve quality of life. In summary, diagnosing primary progressive multiple sclerosis involves confirming at least 1 year of continuous neurological decline, identifying characteristic brain and spinal cord lesions on MRI, finding supportive evidence in cerebrospinal fluid, and ruling out other conditions. Advanced imaging markers can support the diagnosis but are not mandatory everywhere. Always remember that each person's experience is unique, and a healthcare professional experienced in multiple sclerosis is best equipped to interpret these findings and guide care. If you or someone you know is experiencing symptoms, seeking a comprehensive evaluation from a neurologist is the most important step toward understanding what's happening inside the nervous system.